airport and isolate him in a timely manner. The passenger manifest of the airlines has been retrieved and all contacts are known, as the teams at immigration are in possession of the passports of all the travelers that came on that plane. The public is hereby requested to remain calm and vigilant and to report any suspected cases or call our toll-free lines on 0800-203-033 and 0800-100-066, or the following officers: Mr. Tek Kajirita, 0782-909-153, or Dr. Alan Muruta, 0772-460-297. I thank you all for listening.
I apologize, Honorable Minister, for coming late, but could you just please repeat again the situation of the confirmed case, who the person was and when he got the results, and how is it also tracking the people that were around him that might get transferred to the holidays again?
So you want me to read the statement again?
You can also just recap as far as I apologize that I was AFP.
Okay. Do you want me to answer it in form of a question? Do you want me to read the statement? I read the statement again. The Ministry of Health would like to inform the general public that Uganda has confirmed her first case of coronavirus disease, COVID-19. The confirmed case is a 36-year-old Ugandan male who arrived from Dubai today morning, Saturday 21st March, at 2 a.m. aboard Ethiopian Airlines. During the screening process at the airport, his temperature was 38.7 degrees centigrade. This prompted the health teams at the airport to isolate him for further follow-up. Subsequent temperatures taken at intervals of 30 minutes and 1 hour remained the same. He was evacuated to Entebbe Grade B for further follow-up, where a nasal swab was taken for analysis. The confirmed case presented with high fever and poor appetite. He is not coughing, neither does he have flu. However, the persistent fever prompted the health workers to isolate him. His nasal swab was sent to Uganda Virus Research Institute for analysis. Results from Uganda Virus Research Institute showed that the sample is positive for COVID-19. The confirmed case had traveled to Dubai on the 17th of March 2020, that's 4 days ago, for business purposes. At the time of his travel, he was in good health. He is a resident of Chibuli, Kakungulu Zone in Kampala. Currently, he is still under isolation at Entebbe Grade B. He remains in a stable condition, but still running a fever. The Ministry of Health reassures the general public that all measures were undertaken to identify this case at the airport and isolate him in a timely manner. The passenger manifest has been retrieved and all contacts are known, as the passports of the travelers on this plane were retained at immigration and all the travelers were put under quarantine. To date, Uganda has a total of 1,827 travelers, including Ugandans and others traveling back home, under self-isolation and under self-quarantine and institutional quarantine. 827 who are under institutional quarantine. The public is hereby requested to remain calm and vigilant and to report any suspected cases or call our toll-free lines on 0800 203 033 or 0800 100 066, or the following officers: Mr. Tek Kajirita on 0782 909 153, Dr. Alan Muruta 0772 460 297. I thank you.
Thank you.
Just a couple of questions. Catherine Yarmani from the BBC. What are your plans in terms of the other passengers who are on the plane? Are you testing them as well, especially people who might be sat next to the gentleman? And then there's also the general perception that, you know, COVID-19 might have been present in Uganda already. Are you considering mass testing of people who are in Uganda at the moment?
Any other question?
To follow up on that, there's a difference between the confirmed cases in a country and the true cases. What is your estimation of the true cases? Michael Hagan, AFP.
Can you repeat your question?
There's a difference between the confirmed cases in a country and the true cases. Just now the confirmed cases is at 1. What is the number of true cases according to your estimation? And just a follow-up to that as well, how many tests have been conducted up until now, please?
How many tests?
Yes.
Attack?
Samuel Semenon, BBC. We talked about the passenger manifest from Ethiopian Airlines. How many passengers were aboard that flight?
My name is Dahar Namadi, I work for NBC Television. There have been a lot of fears, and the reason why the public wants to have a vigilant is that the health ministry or the health sector is not, does not have the capacity to contain the numbers should they be overblown. This is just one case, but in case they become too many, there are fears that we do not have the capacity to handle this as far as ICUs are concerned and those other needs. What interventions do have in place as a ministry? Then we have been following up on a number of the cases of the Chinese nationals that have just been removed from therapeutic apartments in Guru, taken to some apartments in some hotel in downtown, that's Aruba. The people that try to demonstrate and refuse them to be put in that particular hotel. They were stranded at CPS until the ambassador came to help them. Are we having these people now home to China or are they still in Uganda?
Any other question? Yes.
After the COVID you could say there could be many other people traveling to the country. What is the hope for whichever maybe airline is not running the country at the moment?
Something that we did on TV. We just wanted to go to the past. The government is planning for all these local people because it's believed that most of the local people downtown at this point government fees are expensive and they can't afford to buy snow and maybe masks. Is the government planning to put something for people who are common?
To put what?
Like buying them snow.
Supplies and so on, buying for people, for the public.
Thank you.
First of all, as I indicated, we know all the passengers who traveled on this flight. There were not very many. Are we going to test them? Yes, we could take some nasopharyngeal swabs, but there is a limit as to whether they will test positive or not. But since they are all under quarantine, they are easy to follow up and very easy to evacuate in the event that they develop signs and symptoms. How many tests have we conducted to date, Atek?
We have
So far conducted over 100 tests.
Just to be specific, you're saying over 100. Specifically, how many? What exact number have you conducted, please?
We have conducted something like 120 tests. Not the whole country, from several alerts that come in every day. And like you have said, so we're able to detect this one immediately from the airport to the health facility, and then we confirm.
So when
all the others are negative. Yeah.
So the numbers of passengers on that flight as per the passenger manifest, if you would want to know that position, but I can't tell you off head because I don't have the manifest with me. So I am not able to tell you the exact numbers, but if you want to know, you can access that information sometime tomorrow morning. The concerns that the Ministry of Health may not have capacity to handle the number of cases depends on how quickly we detect and how quickly we manage. If cases are left to go out, that is when you get worried, when they've had contact with one another. But I want to applaud my teams that they were quite vigilant and they got this case and also got all the other travelers because they have their passports. So that is a plus to the teams who are at the airport for a job well done. So all we need to do now is to round up all these people, see those who have signs and symptoms, get them screened, quarantine them and follow them up, which is being done very well. So I must say that in one way, this was good because then we don't have to go into the communities to look for who the gentleman could have had contact with. The issue of the Chinese who were removed from quarantine in Naguru and moved to another area was because the population in Naguru did not want them there. We are having challenges with the majority of the population exhibiting some form of stigma against some people. And so the issue of quarantine becomes a bit of a challenge every time we have passengers traveling in. But we continue to sensitize them because people under quarantine are not necessarily sick people. They don't have symptoms, they are healthy. So they are not a threat as long as they remain in their rooms. And if they develop any signs and symptoms, then we quickly evacuate them and disinfect the rooms. So we'll continue to sensitize the population to understand this. Now the issue of many people still traveling into the country will no longer arise because His Excellency the President this evening issued additional directives to his previous directives that were given on Wednesday. The airport has been closed and the closure will take effect from midnight tomorrow. So no passenger planes will be received at the airport except cargo planes. So that means we will no longer be receiving passengers coming from any country into Uganda. Similarly, no passengers will be crossing on road because the borders as well have been closed to all passengers except cargo. So that gives us opportunity to concentrate on those that are under quarantine in the country. Is government planning to buy essential commodities for the people? I want to believe this is a responsibility of the people. We've been buying soap for ourselves. So people are encouraged to continue buying soap. Soap is much cheaper than alcohol or hand rub sanitizers. So we continue to encourage the population to use soap and water and wash their hands as frequently as possible. Avoid touching the eyes, the mouth and the nose, and For those who have signs and symptoms of cough and flu, they need to stay at home. But even while they are staying at home, we encourage them to report so that we can evaluate them and have them tested just like we have been doing. The 100 tests have been from alerts that we have been receiving from people who develop signs and symptoms of flu and cough, and we have been doing this, removing and analyzing as frequently as possible. Thank you.
Sorry, I think there was one question I had.
One at a time.
A question about whether you're considering mass testing or testing of people who are already in Uganda. And just briefly, the other question obviously in the last few days has been about people who've been under mandatory quarantine and the conditions under which they've been put under that quarantine. So do you think that exposes the weaknesses within your plan and your systems, and whether you're actually adequately prepared to handle this pandemic?
Question for Dr. Olden Mariam. The confirmed case is one, but what's your assessment of the true cases, the number of true cases in Uganda?
What do you mean? We don't understand that question.
There's a difference between the confirmed case is one, but are there other undetected cases currently in the country? Are there cases that haven't been tested?
How do you determine that? We've answered your question.
The WHO's answer.
Well, we understand there's a team of, I think people are supposed to be in quarantine, is kept and tried to go through West Nile to either DRC or Sudan. These were, I think, later arrested. Any plans? Are they going to get in courts of law? What is the update?
Your name, Bruce, and your media.
Has the ministry provided testing status to rural areas where we can take the upcoming messages?
Any question?
I think I want to add on to what you said, because exactly what I wanted to say first. What are the immediate points that people could run to in case someone feels or they see their neighbor, some signs of symptoms?
Okay, we can have responses.
WRI, you can start.
Okay, thank you. The question about estimates there. You are okay? The question about estimate, there isn't a definite model to say when we have the first case, there are so many undetected cases. And also that depends on what measures you have put in identifying. And we can see that Uganda has done a lot in trying to identify the route where people could come. So I can't, or for that matter, very few people might be able to answer that question. We don't have a model to see. What we can see in the rest of a number of countries, both in Asia, in Europe, and in Africa, is that if you put your measures early, then your likelihood of having only few cases is high. And as you can see, there are more than, out of the 185 countries, we have more than 85 countries which has less than 10 cases. That indicates that if you have a case, it doesn't mean you are hiding, or you will have a lot of hidden cases. That depends on how early you put your surveillance system. And as you know, Uganda has a good surveillance system, and we hope we will be able to detect cases easily. In relation to tests, how a nation test makes a mass test or not depends on availability of testers. As you know, the tests are not that, a lot is available. So what we would do starting from now is see the scenarios and support the ministry to do more tests in possible contacts. I'm sure we will not have the capacity like South Korea to do a massive population testing.
Okay, on the issue of capacity to handle quarantine, first of all, let me start from the point of self-quarantine. By the time government decided to move to institutional quarantine, self-quarantine was not working. Many Ugandans were abusing the system. They would move out of their homes and go to various places. When our teams went on the ground to follow them up, they wouldn't be there. Even some other nationals other than Ugandans were doing the same. And so we concluded that self-quarantine was not working and it wasn't effective. However, we have continued to monitor them, and as I said, the majority will be completing their 14 days self-quarantine. Now moving on to institutional quarantine, again, it has proved not effective for several reasons. Many of the travelers are not willing to pay for their accommodation and meals. Two, even when they are able to pay for their accommodation and meals, they keep on walking out of the hotel rooms. But of course, because there is security, they stay within the vicinity of the hotel. Thirdly, there is a lot of complaint and unrest within the areas. And to address that issue, our president today stopped any more flights because we cannot take in any more people who are not willing to undergo a quarantine. So moving forward, we will monitor those who are already under quarantine until they complete their 14 days. From the outset, Uganda was very clear that if you decide to travel into the country, you will meet the costs of your quarantine. But to see people coming in and refusing to meet the costs of their quarantine is very unfortunate. The majority of the people coming in among these travelers are from the Category 1 countries, including China. And we will encourage them to complete their quarantine. However, those who are not willing to complete quarantine, their countries can organize and evacuate them if they can. But from midnight tomorrow, the airport is closed. Regarding the Chinese nationals who tried to escape through Zombo, they have been arrested and they will face the courts of law accordingly. In any case, they only had entry permits into Uganda and not for the DRC where they intended to go. And so this will be addressed according to the laws of the land. Regarding testing centers in rural areas, there have been many trials on point-of-care tests, especially the rapid test kits, developed in several different countries, including China, Republic of Korea, and also the United States of America. We are aware that the test kits in the US has been approved by the FDA. We are yet to receive information from the World Health Organization whether they have concluded evaluation and whether countries can now access these tests and use them if they have been standardized. As soon as that information comes through, Uganda will procure the rapid tests and deploy them in the various areas across the country. We are also considering bringing in the antibody tests as soon as the World Health Organization allows or approves its use to the various countries. Where do people run when they develop signs and symptoms? We don't encourage people to move out of their areas of quarantine when they develop signs and symptoms. They must stay put and call the toll-free numbers or the numbers of the officers that we have provided so that they are safely evacuated to the isolation facilities. Moving out of your area of quarantine or isolation predisposes others to infection, and also when you come into contact with health workers who are not fully dressed with protective gear, it exposes them to infection. And so we discourage moving out of your area of quarantine or out of your home. Please call the toll-free numbers or the officers concerned, and you will be safely evacuated. I think we need to close. We need to run the last round. Wanted to have a one-to-one. Just encourage Ugandans. Okay.
Before you ask your question,
This is a team carried out an operation in Nakuru where we intercepted 2 or 4 Chinese who had been able to come.
We have answered that question. I think let the minister conclude.
Thank you so much. I'm Colonel Singer from New Vision. Honorable Minister, thanks for the briefing. I understand you have an issue of porous borders.
We've got reports of people actually using bicycles to cross into the country at the Rwandan border. Not at the exact entry point, but in the villages near the entry point. So my concern is, what is the government doing to make sure we completely seal the borders? Because they're not using the official entry point, but are using the villages near the entry points.
If you listen to His Excellency very closely today, he did
give a very elaborate brief about the border crossing points. First of all, we are aware that we have over 55 well-designated entry points and nearly over 103 unofficial entry points. And he did indicate in his statement that we shall have enforcement officers, the police and the UPDF, patrolling the unofficial entry points.
Okay. I just want to give one word or two. Fellow Ugandans, you will realize that as we end today, 21st, we have received such a case. And therefore mine is just to encourage Ugandans to stay calm and to use the advice given by the Ministry of Health, and also to adhere to the directives given by the President. All of this is done in our good faith. We all want to live. Fellow Ugandans, we need to tighten our belts, because the problem that we have been seeing from far is now knocking on our door, and we have to really we have to put our feet down and say we have to survive this scourge. We had at least taken some days before we get it. I also want to encourage fellow Ugandans who wanted to go out and do business, despite the fact that we have closed the borders. And this was our first advice on the onset. You realize that this young man left Uganda the other day on 17th, and now he comes back with a problem from Dubai. So I want to encourage our people to stay calm. Our government is in charge, and we know that the Ministry of Health officials are really going to help calm the situation. With the prayers that we had today, I definitely know that God is on our side. Thank you so much.
Good. Thank you for coming. We shall be giving you more updates subsequently, and let's keep verifying whatever information we get. Thank you.
What do you know the minister can do down in Uganda?
That is good enough. Honorable Naband.
In summary.
Summarize that.
Okay.
Okay.
Bannayuganda bannange mwenna abatulaba n'abatuwuliriza, olunaku lwa leero ng'ennaku z'omwezi 21 omwezi ogwokusatu ku ssaawa zino zennyini